Good morning. Your student Donald Alexander Gilpin. Here at the Motel 6, 4123 West Century Boulevard, Inglewood, California, or 4123 Century Boulevard West, Inglewood, California, third floor. I'm on the amazing 5x12 matrix in combination with Polygon Chemistry and medical pharmacology, or chemical pharmacology rather. Those sorts of three combinations. The IPC, as it stands for Illuminate, or Illuminated Polygon Chemistry, and a spin-off from the Amz5x12 matrix. And international, the IUPAC, as I said, represents the International Union of Pure and Applied Chemistry, and the IPC is a derivative. When we take out the U and the A, although the chemistry is being applied here, but this is really illuminated polygon chemistry. I have coined or synthesized that term because the slides that the structures are on are illuminated. So let's look at some structure. Projected the Amz5x12 matrix in the pharmacology configuration. I know that it could have also been in the monetary economic configuration, but now we have it in the pharmacology configuration, and more specifically with a structural pharmacology configuration. But we're looking at structure instead of numbers this morning. So let's go right into it. And for this, we have the first one here. What we have is an ophthalmic drug here. Hydrochlorozoline, which is used in the ophthalmic sense to let's illuminate it here. Hydrochlorozoline, an ophthalmic drug, and hydrochlorozoline hydrochloride. Which one of them is the part of Vicine? I don't remember. Okay, but this is hydrochlorozoline, and it's illuminated here. And later on, we will look at more detailed structural analysis with these various molecules and atoms attached to these polygons. But for now, let's just present illuminated ophthalmic drug hydrochlorozoline, or hydrochlorozoline the point HCl is hydrochloric hydrochloride. Second one we look at here is articaine, which is a dental drug used in dental procedures, as a dental anesthetic, and it's illuminated here, articaine. So numb the gum and the lips and ease the pain. A dental drug, dental anesthetic, and here is the structural representation of the articaine. More upsided here on an illuminated slide, and we later on look at the structure in more detailed analysis. But for now, this one is chloramphenicol, and let's illuminate our lumen chloramphenicol here. I notice simultaneously we are having some three-letter abbreviation. For chloramphenicol, we could have a CMP, which is not necessarily the same abbreviation used for the brand name projection of these drugs by the various original pharmaceutical company that synthesized the drug and that as the patent. But this is just for the Amz IPC projection research. Chloramphenicol on illuminated slide. Illuminated pharmacology or illuminated chemical pharmacology, or illuminated polygon chemistry. All right. Here we have another one. I'm taking up random from a company of about 35 to 38 light emitting diodes, which are slides, Illuminate slides with the pharmacology structure of various drugs drawn and then. This is to make the analysis more vivid. This is a tetracycline, and we have a tetracycline on the illuminated side. This is one of the drugs that is used to treat, it's an antibiotic type drug, broad spectrum, that is used to treat various infections. And I can remember sometimes it's used to treat NGO, non-gonococcal infection, and other infections of the body. Sometimes using in a sense where the penicillin, the patient is allergic to penicillin, we use the tetracycline. And for this we could use TCL or TET for the three-letter abbreviation, tetracycline, or TCL. Later on we'll look at the more detailed structural analysis of this with the various polygons and the double bonds and the single bonds and the various hydroxyl, oxygen, and methyl group attached to these bonds. But for now, this is tetracycline and broad spectrum antibiotics. Taking up some more random drug synthesis projected on slide. And for this one, this is an oncology drug, and this is Revlimid. Revlimid. Let's illuminate or illumine Revlimid. Used to treat various cancer here now. I think this is one of the versatile one that is used to treat many cancer. But we have like the new Laster, which is used predominantly to treat breast cancer. We later on probably see that one on a illuminated slide. So this is Revlimid, a cancer treatment drug. And we'll look at the structure in more detail later on. Let's go on. Picking up here. This is now chloroquine, and this is a drug that has been highly touted in political circles in the treatment of the COVID-19, the virus that caused the pandemic, the present pandemic. So this is I believe, let's see if this is the chloroquine, yeah? Or the hydroxychloroquine. Yeah, this is the hydroxychloroquine and chloroquine. And we'll look at let's illuminate it, yeah? R equal OH and R equal H, chloroquine and hydroxychloroquine. We'll look at the structure with the hexagon and their pentagons and the double bonds and the HN and the various atoms and nitrogens and molecules attached to these polygons. And it's IPC. So that's chloroquine and hydrochloroquine. And in combination with azithromycin, this has been studied, research to treat the COVID-19. Let's take up here, and as we move along, this is paracetamol. We've illuminated paracetamol, and this is the structure of acetaminophen, and this is probably we could use ACE and or PML for paracetamol. I think this is also the brand name for Tylenol as well. Paracetamol, pain reliever, non-steroidal anti-inflammatory, and acetaminophen. And this is the structure drawn and on an illuminated slide. Slide is presently illumined. As you click up here, this one is azithromycin, which is the other part of the combined azithromycin hydrochloroquine. That is the, I believe this drug has been used, the chloroquine has been used to treat malaria, I believe, or one of those diseases that affected humanity way back there. But azithromycin is a derivative from erythromycin, which is an antibiotic used to treat various infections. And it is used sometimes when the penicillin, when the patient is allergic to penicillin. So we have azithromycin in combination with hydrochloroquine, or chloroquine, which is used presently to treat the COVID. And this is the structure. Look fairly more intricate than the rest of structure so far. Fairly more saturated with molecules. And look at this one here. This is a polygon with many other sides, more than 6 sides here. This is 6 sides. We might have some pentagons as well, attached with H3C molecule, OCH3, OH, O, hydroxyl, and we look at all these atoms and molecules, usually organic molecules that comprise or is integrated to bring about the synthesis of this structural azithromycin. It's illumined, like I said, and hence IPC, Illuminated Polygon Chemistry, or Chemical Pharmacology. Let's pick up one more here, and I believe this will be one of the final, so that we don't run the video too long. This is another oncology drugs, and this is Opdivo. Let's illumine Opdivo. Now it's illuminated. Oncology drug. This is the structure of it with the various hexagons and the various double bonded oxygen and HN and carbon and nitrogen. We'll look at this in more detail, structural analysis, but right now we just present to you Opdivo, which, what it is now, is this one also a breast cancer drug? Opdivo. Well, we know it's used to treat cancer, and some of them is predominantly breast cancer, like the Neulasta and the Neulasta, which are the drugs there we had in the forefront that was breast cancer related. But we had, I think the Revlimid was more multiple applications in treating head and neck cancer, blood cancer, non-Hodgkin lymphoma, and so on. But this is Opdivo, and it's a cancer drug. So let's plug it out so it becomes not illuminated. All right, this is the last one. We have about 38 of these, and we'll probably say this is chemistry 138 or 137. And electrochemistry, this more electron illuminated synthesis, pharmacochemical synthesis and structures. Let's see here. Abiraterone acetate. And this is Zytiga. The brand name is Zytiga. This is also a cancer drug. This is the last one. in this presentation. Zytiga, brand name, and as you see, the generic name or the chemical name is a long name, abirate rone. Abirate rone, and it's acetate, and it's Zytiga, and this is the structure, and we have illuminated the structure. And it's a cancer drug used to treat various cancer, and we will look at the structure and the application to treat the specific cancer in more detail. Alright, so we have 38 illuminated slides here, rather 35. I think 3 of them is missing, but we'll furnish those 3 that is missing. And we have the significant number IPC 138 or 137. Electrochemistry 137, IPC 138, 137. Alright, so and we have presented a couple of them this morning. In another video telecast, we'll present the rest of structural synthesis of the various drugs that is extrapolated from our Amz5x12M matrix in the pharmacochemical configuration. So we'll take a break here and we'll return at another time with some more IPC.